Hi, and welcome to Conversations with Des. I'm your host, Des Blanchfield. I'm joined by Rod Cruz. Now, Rod is the General Manager for Healthcare Solutions at AT&T Business. Rod, great to see you. Thanks for making time to catch up, and welcome to the show.
It is always so good to be with you, Des.
Indeed. Now, I was hoping we could have a conversation around a number of key topics that are on everyone's minds at the moment, particularly around consumerism and healthcare. So I wonder if we could just kick off with that as our first question to you. Could you just give us a general sense of where we're headed with as far as consumerism and healthcare goes?
Yeah, I'd be happy to, Des. For over 2 years, we've been very focused on paying attention to the rise of consumerism in healthcare. And really what that means is that the providers are beginning to think about really their end users, their patients, not only as patients, but as consumers. So from the way they digitally interact with them, from maybe the way they check in, to maybe how they provide transportation services to and from, perhaps using a wayfinding application to navigate through the provider space, maybe even down to when you check in, you get a patient bracelet printed out with an RFID chip that tracks your journey and your mapping within the provider space. So you understand their digital experience as they move around and receive care. So there's a couple of other things we're doing. We're also thinking about how do you communicate and really have a seamless engagement before and after procedures, right? So how do you really do that through maybe a mobile app? And then finally, we're thinking about how do you stay connected with them? How do you provide additional information about the care, the cost, and really the outcome in advance of even engaging in that? It's really the only industry, Des, in which you'll walk in and you'll actually sign up for services received and not have any idea how much it's going to cost you. So I think that those consumerism trends are starting to really bleed into healthcare and really going to be really the foundation, the bottom line framework that's going to be expected in terms of how you do business and healthcare going forward. So we're very, very excited about that trend, and it's something that we're spending a lot of time thinking about and building really transformative solutions to really enable that experience for the patients slash consumers and the providers.
Indeed, and and even in my case, we've had a scenario recently where our son broke his arm at a soccer game, and we went through that entire experience of someone being called out on the field, at the sporting field at school to check him out, and his wrist was in a very bad way. An ambulance came along. We followed the ambulance to the emergency care, went through triage, waited for some time for the surgery window to open up, went through that process, had post-surgery, and as you said, we didn't once think about the cost or consider it. And frankly, we weren't presented with the costs. It wasn't until afterwards we realized there might have been a bit of a sticker shock. But you made an interesting comment there. I wondered if I could just circle back on, when we think about consumerism in a number of other industries, we used it with things like social media, with applications. I don't think twice about now downloading apps myself as a full self-service consumer on my mobile devices or on my laptop. And certainly now with cloud services and software as a service, it's an assumed. Do you think healthcare providers are positioned well now to essentially respond to that self-service readiness that consumers ourselves have, and that we're running around with mobile devices, we're used to downloading our own apps, providing our own support, but also now, in a sense, demanding that flexibility and capability and awareness? I imagine this is where AT&T Business is very well positioned to help these healthcare providers who are predominantly focused on the actual provision of healthcare services and not necessarily always going to be well prepared for that consumer front end.
Des, that's exactly how we're thinking about it. We're merely plagiarizing how other industries treat their customers. To your point, whether you're using a check-in kiosk, which is how we really engage with our financial institution. If you're even going to an ATM, most of us probably do that with our smartphones today. Whether you're checking in to board a flight, to obtain a boarding pass, you can go to AT&T Stadium here in Dallas and then buy one of the Dallas Cowboys jerseys through a kiosk now. So to your point, I think it's just the expected experience that those patients slash consumers are going to have in healthcare. And to your point, that's we're really well positioned to leverage our connectivity, deliver those immersive experiences that they really expect. To your point, it's going to be the common denominator. In my opinion, the providers that solve to that and really shift and drive that transformation will be the ones who will be successful going forward in healthcare.
Indeed, and as you said, we've seen that in other industries and other market segments. I'm curious about where this now comes with regard to, and where it sits with regard to the likes of, say, the connected ambulance. You've got this very exciting success story that every time we speak, I highlight this. But you know, as a kid, I was always obsessed with ambulances. All my friends were excited by fire engines and police. I was the kid that used to get obsessed with ambulances because I was fascinated by what happened when we went into one and headed off to a hospital. But when we think about consumerism all the way down to that experience, which may be unfortunate in many cases, that I'm being picked up by an ambulance, but I'm excited by what's happening in your connected ambulance. I wonder how consumerism now integrates into a mobile platform as complex as a connected ambulance.
Yeah, Des, I'm convinced you were, in your past former life, you were an EMT, because every time we have this conversation, I know you really enjoy it. But no, I do think about, I mean, the way I think about the patient experience and consumerism is really, how do you stay connected with that patient, right? And if you take that same model and move it to the connected ambulance, it's still the same. So the connected ambulance is a concept that we're very bullish about. We're actually launching a AT&T Foundry initiative to bring all those ecosystem players and partners, and I'll describe who they are, to be able to build an end-to-end solution. And the connected ambulance, really the guiding principle is you've got basically a hospital on wheels that could be mobile within a city or even a rural area to be able to deliver care when it's most needed. So if you've got an accident that may be 30, 45 minutes away in a rural area, this connected ambulance comes with basically a virtual ER capability that we enable through our connectivity, right? So that's really kind of the fundamental concept. So as you compare the connected patient and consumerism, this is basically an acute care space. How do you stay connected through that point in time to be able to deliver the care at the point of the accident? So it all begins with really creating that virtual emergency room, really arming the EMTs with all the peripherals and medical devices to collect patient vitals at that point of the accident, to be able to grab that information, push it out to maybe the electronic medical record, collect that information, and move it out to the emergency room where the clinicians can begin analyzing and triaging and really start even administering medical care over the connection. And then also be able to take that information and even display it for the EMT to be able to provide care. So you've got a lot of different very cool work streams in terms of collecting data and being able to do that, even establishing a telehealth session as well. And then I think the cool one that really adds the 5G dimension, which you asked about earlier, is the EMT would maybe be able to wear headgear to start collecting and videotaping that particular session. So as the ambulance docks back into the hospital, it really moves into the 5G geofence and then download that information very, very quickly. And as we'll talk later, we'll talk about the 5G use cases, moving large MRI images, files, PAC images within a healthcare system is one of the use cases we think is one of the ones that's going to really take off. And so this is the same concept where you're collecting all that information, images. As soon as the ambulance docks into the hospital, if you will, that information can be moved anywhere in seconds to be able to really hopefully save the patient's life. So this whole entire connected ambulance concept is something, as I mentioned earlier, we're working with the AT&T Foundry as we're bringing in an ambulance company, a provider, a payer, an EMR company, hardware, software across our connectivity platforms to be able to really design the end-to-end solution. So we're going to sit down, go through the requirements, what is the expectation, what are the work streams, data that you capture, data in rest, data in motion. Think about all the other PHI and HIPAA and high-tech requirements you've got to think about as you use that information and be able to build an end-to-end solution. So we're very, very excited about it. I'll be very happy to give you all the inside, Des, when we talk again here in a few months.
Indeed. One of the things that strikes me in all of that is that there's been a heavy lean towards a focus on the service provider up till now with a lot of the technology solutions in this whole stack. It seems to me like AT&T Business has now managed to help the flip this coin in that now there's also equal focus on the enablement of the consumer. We often see scenarios where, you know, we're all used to it in movies and TV shows where there's an emergency and someone's thrown on the gurney and put in this bus and driven away and they're in an unconscious state. But the data seems to show that 99% of people that are put into an ambulance are awake and they're talking to you and they're making decisions. now as a consumer, I feel like what AT&T Business has done with the connected ambulance, with some of the technologies like the emergence of 5G, is that now everything from my wearable technology, my smartphone, whatever it might be, I can make informed decisions, and I can make data-driven decisions, as it were, when we talk about this in enterprise. So that as I'm being picked up, I might have had an incident or whatever the case may be, but I'm likely to be awake and aware of what's going on. And now I can make those decisions on, what level of healthcare have I got? What specialist could I choose? Potentially even what hospital do I go to? That must be an exciting pivot to see take place now, that by enabling this, AT&T Business is effectively making me a more informed and more connected consumer, bringing that capacity to be, I guess, a self-service celebrity experience as a consumer in the connected ambulance all the way through to the hospital. Because I don't think it's the case that everybody that goes into these things is unconscious in a 99% bad state. I think it's more the case that we're able to have a conversation with the people caring for us, and we're awake during that journey. That must be a significant game changer now you've made that pivot possible.
Yeah, Des, I think when you are able to leverage the connectivity platforms, so whether it's 5G, whether it's 4G LTE, IoT low band, our FirstNet, our first responders network, and then blend it all together, right? You're able then, to your point, provide information to make real-time decisions. To your point, not only to the clinicians providing care, but even to the patient. So that dimension of consumerism, that dimension of having information at our fingertips so that we're informed and intelligent to make choices, that is one of the byproducts of the connected ambulance. We're super happy about the work we're doing in that space.
Indeed, as am I as a consumer. Not that I necessarily want to be in an ambulance tomorrow. We've talked a couple of times about this topic, and I wanted to just revisit it briefly. Some of the new and emerging exciting technologies like 5G, it's a very broad topic. I wonder if we could dive into a couple of the use case examples that you have, and you mentioned the use cases earlier on, specific to 5G and how it's enabled this whole connected ambulance concept.
Yeah, so there's several use cases that we've got a point of view on, but I want to really step back for a moment, and really the way we're thinking about it is we're really building a 5G roadmap with our customers. The ones that are interested in really driving the transformation and being able to build that roadmap with us, those are the conversations we're having. So we've got an opinion, we've got a point of view, we think we've got some good ideas, but obviously the marketplace will really bear those out over time. And so I'll walk through a few of those. So we talked about in the connected ambulance, the ability to move very large images and files. And if you remember last summer in our AT&T Business Summit, we had a demo where we had a 1 gig file that was moved. It was a video image, actually, a video file moved on the 4G network, which took over 4.5 minutes to download. On a 5G network, it literally took 12, 13 seconds. So I think at the end of the day, you see how very quickly moving that information real time, where and when it's needed, is a game changer within healthcare. So I would start the 5G use cases as moving very large images and files. The second one, the big area of focus, is education and training. So many different applications of how healthcare, whether they're teaching their nurses or their physicians or clinicians on new procedures, whether it's even a medical student, rather than being in a lecture hall, having 3D virtualization images and having textbooks come to life. The data is really immense. It's really immense, and it's overwhelming. When you think about somebody being in a lecture hall, retention rates are 10 to 15, 20%. When you do hands-on and you're actually able to see this, that number jumps up to 90%. So I really think as we get more comfortable with that model, I think it's going to really take off in healthcare. It's basically, as we've talked about, Des, it's a fighter pilot simulation for the medical industry. So we think education and training is another big one. There's also a subset of that, which is the remote robotic surgery. So we're doing some work with some higher learning institutions to be able to really bring some learnings and some proof of concepts in that space to be able to do that. So we've done that with some animals. Again, it's got a ways to go, but really the model, the connectivity, the latency, the speed of the connection, the jitter experience has to be real time. You cannot have any delay. It is obviously very, very enabled by the 5G platform and connectivity network that we provide. The other one that I would point to is cognitive behavior therapy. So we've got a very big trial going on with Vitas down in Florida, who is the largest hospice provider in the United States. And so the thinking there is if you can decouple the brain from the body to be able to really distract them, it really provides a different experience. There's also good research there that it shows a 30% patient improvement experience. The respiratory rate goes down, their anxiety level goes down, the blood pressure goes down. And so that's just, you're basically distracting them. And we're doing things such as a meditative walk through the woods, sitting on the beach, maybe even seeing one of the 8 wonders of the world to be able to distract the patient from the pain they're experiencing. And so that plays really well in hospice and end of life experiences, but also a couple of other use cases. You could think about a pediatric scenario with a child, or even patients that have chronic pain management. Rather than putting them on opiates, you can put them on this kind of therapy and obviously avoid addiction. So those are some of the use cases, Des. But I'll go back to, again, roadmap being built with our customers. Number 2, we think about what is the problem they're solving, right? So what is the trend, and what is the opportunity we're solving to? Then number 2, what is the solution we can implement there? And then 3 and 4, what are the products? And then the last thing is the connectivity. So the good news is, regardless of the connectivity, just like the connected ambulance, it could be a convergence of many of these platforms, or it could be 1 or 2. But if it is 5G, like a remote robotic surgery, that's what we're going to recommend. And I think that's what's going to drive the adoption of these use cases. I'll close by saying it. This makes me think of 2000, 2007, 2008, when the iPhone was launched, and then 2008 when the App Store was rolled out and developed. Last year, at the end of 2019, we had over 4 billion downloads of applications, across smartphones. And so at the time in 2008, I don't think anybody had every single use case, every single app defined in terms of what it was going to do over the next 10 years. I think that's what 5G is going to do. It's really going to be a catalyst to drive really, really cool innovation in healthcare. And again, it's going to take time before all those use cases. I will tell you, what we're seeing a lot of really good traction in the space is any of the providers that are building new buildings, new locations, where they're not having to think about transforming digitally their solution set. They're not thinking about ripping and replacing. They're future-proofing all of those environments, and that's where we're seeing a lot of really good conversations with our customers in terms of, hey, I may not be able to get every single use case right today in 2020, but I know I'm going to need the connectivity platform to deliver those immersive experiences, to transform all the different work streams in our system. And so those are really fun conversations we're having, Des.
Indeed, yes. I think there could be no question that AT&T Business putting a 5G solution into a healthcare provider of any sort is definitely going to future-proof them sometime. I like the example you gave of the demo that you provide in many events now, and I've certainly enjoyed playing with it a few times, too many probably, of the comparison of previous generation, whether it's 4G or LTE versus 5G, and you go from minutes to seconds. I think that's one of the most stark moments where I look at it and realize, yeah, this is not just a stepwise improvement, this is a complete game changer. I love that example of the Vitas VR experiment that you've had. I think that, for me, is one of the things that's going to completely change lives, particularly given that in that example it was in hospice care, where people have got a lot to deal with. It's end-of-life experience, and the last thing they want to be dealing with is risks of high-powered drugs. To be able to step out of their bodies and minds and go for a walk around Machu Picchu, I think one of the demos is just an amazing thing. I can't even come to grips with how exciting that is. I wonder if we can maybe, just as a last question for you, perhaps, you are so well positioned, not just in healthcare and certainly within AT&T Business, but as an industry thought leader on a global level, for this particular question. I wonder if you can give us a sense over the next 3 to 5 years, what are some of the key trends and challenges that healthcare providers are going to face? And there's a very broad remit here, so I wonder if we could do it from a couple of sides. We've got specialized healthcare in some areas, and then we've got the very niche sort of emergency response or healthcare in aged care provision. But it seems to me there's some common components in that come back to those enterprise and business challenges that people seem to be facing. How do I gear up for the appropriate skilling of my existing staff? what should my HR people be thinking about with their new interviews and onboarding people, all the way through to just some of the cultural behavioral shifts. I think the technology itself is very exciting, but I also think that it must be the case that you're being presented with a lot of people coming to you saying, Rod, can you and your team at AT&T Business help me just transform my business to prepare for 5G? What are some of those conversations like? And if you don't mind, maybe just as a final wrap up, just give us a sense of some of the biggest trends and challenges that are going to come up and how we might face them.
Yeah, I'll take that question in two parts, and I'll focus the first part of my comments around where kind of the trends are, in the next 3 to 5 years from our perspective. And I believe, obviously, front and center, the anchor of the conversation is going to be 5G. As we've already discussed, it's going to drive transformation. It's going to be a catalyst. It's going to be really a game changer in terms of the immersive experiences. Not only that you can deliver through a connected ambulance or even the patient experience, but even to the connected caregiver, right? So you talked about what are the things we've got to do to really staff up and prepare. I think 5G is front and center in that discussion. So we're very proud of the work we're doing there. And again, I think the cool thing about AT&T, regardless of the connectivity requirements, the portfolio is robust across the wireline and the wireless dimensions that we can add value regardless of what's required. I think if we have a good understanding of the problem statement, the opportunity, what we're trying to solve to, I think we've got enough expertise to be able to design that platform that's required to really deliver to what the customer is expecting and then exceeding those expectations. So obviously 5G is there. The second one is FirstNet. We talked a little bit about it around the connected ambulance, but that's a big responsibility. It's really an honor for AT&T to be the carrier that was selected to build the government's first responders network. $40 billion investment, 25-year contract for us to be able to provide those heroes that network that will always be 24/7, 365 across the entire 50 states, dedicated for their use if and when they need it. So FirstNet, obviously law enforcement, fire departments, but healthcare EMTs are really the third leg of that stool. So the work in FirstNet, crucial and vital in terms of what we're doing. We did talk about the healthcare expectations around the rise of consumerism. I think that's going to continue to be a theme, whether, again, you're not tracking them throughout the provider space with the RFID bracelets, whether you're having to tether and couple the patient identity to the medical record, whether you have wayfinding solutions, whether you're communicating pre and post ops and procedures. I mean, I think the transparency and cost and insights, all of that, being able to connect and really have that information be brought to the front is going to continue to be a major trend. Then I'll close. I think we spoke it on the podcast. I think remote patient monitoring and telehealth solutions will be really, really exploding here in the U.S. We've had some regulatory changes where CMS, Medicare, Medicaid have now really modified the reimbursement models, where now those are going to be, very, very ubiquitous across all of healthcare. The cool thing is we've got a very, very strong RPM solution we want to talk to customers about, leveraged by our secure connectivity to be able to enable those. So I think those are probably the big ones that come to mind, Des. I'll also now move to the second part of the question. I do think that with, like, just to thinking about 5G, you're right. I mean, they're going to have to transform. Just like as I think back to AT&T a few years ago when we went to a virtualized network, right? When we started moving, we had to really retrain basically the entire employee base to be able to educate them. We've gone through those transformations before, and we can really help those customers. So if a customer to ask me that question, it's almost like, hey, this is the model, how we thought about it. Let me show it to you. And they've always responded really positively, because it isn't just technology. And it isn't just work processes and streams. It's really everybody else around it, that whole entire ecosystem does. And so AT&T is a phenomenal model in terms of being able to transform, just like we did, our core network and everything else, all the work processes, methods and procedures, all the training and the upskilling we had to do. And so we've got a little bit of experience in that space as well.
Indeed. I always like to think of it along these lines, and that is that as an organization, AT&T, and certainly AT&T Business and your team, you effectively become your own first customer, because you have to solve the problems for yourselves to use it inside the organization, and then you have to be ready to take it to the market ahead of the curve and be ready and willing and able and waiting for the market to catch up. Well, Rod Cruz, it's exciting to talk to you each opportunity I have, and thank you so much for making time. I love the insights you are always able to share, but I'm also always keen to just get a sense on kind of where we're going with the trends and what we need to keep up with. And I loved the example you gave there around just the shift towards us being able to be more of a consumer in the healthcare space and be better informed. And I did like the underpinning message that you've been here, you've done it for decades, you are experts in this space. And if there's one area not to take risks, not to take chances, it's definitely healthcare. Rod, congratulations again on FirstNet. It's an amazing success story. And I think it could be in no better hands than AT&T and AT&T Business and your team. And I look forward to catching up with you again. And thank you so much for your time.
Always a pleasure, Des. Thank you.